Friday.
All right, thank you very much for staying with us. Halima Fashakin, our health correspondent here, taking us back to some of those reports that were done a few months back when Vice President Yemi Osinbajo was then acting president. And of course, he dealt with health issues, both in Nigeria and in the ECOWAS sub-region. Well, my guest, once again, is Professor Tony Ogiamien. Professor Ogiamien is the president of the American Heritage University in Southern California. Prof, thank you very much for finding time to join us.
Thank you.
Let's begin by taking a look, an assessment of the health infrastructure in Nigeria. What are your thoughts? Do they meet up to the standards that are acceptable globally?
Well, the global acceptance of health infrastructure is normally based on the best practices. And if you were to look at Nigeria within this context, you'll find that we have very, very serious problems. Stemming from how the health ministry is structured and how we have inadequacy of diagnostic equipment and materials, and how we have flight of our Nigerian doctors going to seek greener pastures abroad, and how there's lack of adequate treatment and advice to Nigerian patients. So all said on the one hand. Then on the other hand, we want to know how far the system accommodates individuals that seek medical attention. I think there are about 15 to 20 regular diseases, but I'm leaving that. I'm looking into how new children are created, which is a health issue. I want to look at it. Is it a handicap for which our health ministry should look into? Can we give them treatment? We must first resolve that issue. Let me tell you why. When you look at abortion, because abortion and creation of children, one is the obverse of the other. That is the right to reproduce and the right not to reproduce. The right not to reproduce is abortion. And we have legislated on that it is a criminal offense if you commit abortion in Nigeria. I have a series of articles on that. Abortion is still criminalized in Nigeria. Now, that is on the one hand. On the other hand, facilitating new birth technology. I want to have children. I cannot have children, which is also right to reproduce.
Yeah, but Prof, we cannot begin to look at all of those rights if we do not look at the Nigerian health system itself. First and foremost, whether or not we actually have the infrastructure and the wherewithal,
okay,
to deal with some of these very common diseases that you talk about 20 or so.
Oh yeah, those are being taken care of because the medications are there, and our doctors are trying. But the only thing are the diagnostic equipment.
That's right.
Yes,
because we have very many cases of misdiagnosis.
Oh, that leads to malpractice. Doctors do get involved in malpractice. That means that is where when they deviate from the normal course of treatment. Okay, that one is well settled. But the area I'm going into is different.
That is reproductive technologies. First of all, tell us what reproductive technology is all about.
Okay.
We talked a bit about it when we
started.
No,
you actually introduced it to my satisfaction. This is the technology that has been developed in the 1900s in animal reproduction. It started out by artificial insemination, which in the course of this discussion, I want to expose how doctors handle it unethically. Artificial insemination, now carried to human beings, had been in existence since the 1900s. In England, it started some 5 decades ago, Canada, Australia, everywhere in the world. But it became very popular in the last 3 decades. It occurs when there is male factor infertility. When a man semen is deficient or does not have cells in the semen, then that man cannot father a child. You need at least 80 million of cells of sperm count to be able to pregnate a woman. Where this is lacking, no matter how well they have sex, they can never father a child. And the same is true when there is what they call rhesus factor, blood incompatibility. Now let's focus on male factor, because that's what is being practiced in Nigeria in a very clandestine manner, and where there's ethical issues. The way that is being carried here is wrong, because the best practices said when you diagnose a man or an infertile couple and the man is infertile, the man cannot, his sperm count is low, it is the doctor's duty to recruit and select and match the face of the man. It takes time to do all this so that everything is done properly. Now, let me tell you, the technique does not entail any medical expertise. That is why girls in England, career women, are doing what they call self-insemination group. You know, women just inseminate. They don't lesbians. They don't want any husband's problem. So girls they inseminate themselves with the sperm of their boyfriends, and then they're able to bring back pregnancy and eventually a baby. They are not doing that. What is involved is the taking of the sperm into a canister capsule, into a container. And then they use a plastic syringe. Plastic syringe now, the syringe they're using, giving injection, that is all they do. They use it or they draw it, and near the woman's ovulation period, they use it into her uterus, and then the woman become pregnant. Should that be a big deal? Now, according to best practices, the doctor is supposed to select, match, and ensure that there is absence of any deleterious material or any congenital problem, maybe flowing from where the source of the sperm, because they use young people around their clinics to donate sperm. Now, the sperm they donate could have some kind of problem, which eventually will be passed on to this woman. So sometimes there's failure to detect for those deleterious materials, which a reasonable practice would have revealed. So they don't do it. So we end up having problem bringing in new infants to the system through the way some of the doctors, I'm not saying all of them, some of the doctors are doing this for money. That's artificial insemination by donor. It doesn't cost anything. Well, the one that costs money, you will find that the success rate is very low. That is in vitro fertilization. Now, every other technique that's rightly mentioned are built around IVF, right, where pregnancy occurs outside and the resultant embryo or conceptus is put into the woman so that the woman can now carry the pregnancy to term. And then, of course, surrogate motherhood, for example, the woman cannot cannot carry pregnancy to term. So, looking at it broadly, we had this problem in 1985 when it was reported in Nigeria here, under Emmanuel Nsan, a five-man...
Professor Nsan, who was then health minister.
Emmanuel Nsan. Yes. Emmanuel Nsan, NSAN, was the health minister, set up a five-man committee, a panel rather, to look into the claims from medical outfit in Enugu and Luth in Lagos. What they found out was that the two centers were actually, the Enugu Medical Center was not ready at all, non-starter. And then the one in Lagos was actually trying out in vitro fertilization. But both centers were carrying out artificial insemination, which can be done by anybody.
when you say can be done by anybody, I mean, should it not be done in
medical setting?
In a medical setting.
Well, that's why, you know, we in Nigeria,
in a regulated setting.
In Nigeria, we operate what is called the doctor knows best, you know, system. You know, in Nigeria, people live, you know, my life in your hands. You know, Nigerians are always appealing to doctors and say, my life in your hands. Please, doctor, help now. Please, doctor, help now. Because they don't know their health rights. You know, the informed consent issues are normally violated in Nigeria. If you know that a particular patient has approached you, you must expose it you must disclose it to the patient. Now, let me give you the variance in artificial insemination by donor. There's what we call artificial insemination homologous. I will explain that. We also have artificial insemination by donor, bringing a third-party sperm. And then what we also call combined artificial insemination by donor. The combined artificial insemination by donor is where the doctor wants to make the man believe that whatever he did, you know, is actually, the right thing that brought about, knowing very well that this man's sperm was there was nothing.
Low sperm count.
But yes, he will make him believe that he's a participant. So he takes his sperm, of an active young man, then put them together. Remember, sperm lasts for about 72 hours. So when the sperm is put into a container through masturbation, this is why this topic usually require different other people. Maybe we can have a part 2 where we bring in people from religious views. We bring people. We bring fertility doctor, because I like to attack them. Where we bring in nurses, then we bring a layman from the street, a woman from a community-based, and then we explain it to this woman in pidgin English so that she can understand how how babies are made. So we need regulation. In Israel legislated against it. Italian, until recently, they all started to see the need for it. We have not done that. We need legislation for artificial reproductive technologies so that at least we are sure of what we have. So leaving it to doctors to bring sperm from unknown, using young boys to donate their sperm, will bring about problems in the future. Who knows where all these diseases are coming from? We have enough diseases already, particularly with doctors who don't do these things correctly. You know, and that reminds me of sperm bank. Sperm bank is another problematic area. Sperm bank require the banking of a sperm or egg in a center where they have the banking facility. What does it mean? They bring the sperm or egg, put it into canister capsule, and then put the canister capsule in liquid nitrogen and maintain the temperature of about 10 Celsius below zero. Now, you and I know very well that those things cannot really work well in our system because of the fluctuation of electricity. Guess what? Problems are already arising from the use of thawed sperm. You know, it's like ice cube or ice block. You take it out, you thaw it, and they use. So some more problems will begin to come up with sperm banking. So depositors of this sperm, some people do it. They say, well, I want to have sperm so that when I die, I want to have 2 or more children posthumously. They are around Lagos, and they are doing it all the time.
So this you will say that this is becoming more rampant, more common in Nigeria than it was, say 10, 15 years back?
No, going back to before the Grillo report in 1985, it was already, doctors were practicing it at a very low scale. But because we don't believe in the statistics, you see, I've done a lot of research in this. The statistics are wobbled, and we end up with guesstimates. Even the 10-15% of all marriages that are infertile are still being doubted because it has increased. And to a very large extent, men are responsible for their infertile homes, men. But they keep blaming it on women. who will now begin to go from one native doctor to another seeking medical help. Because once a man and woman get married, right, the first thing is to have a baby. Now, we say they become infertile when there's unprotected sexual intercourse for at least 3 years. You know, most women, some women, parents cannot take it. Oh, you still haven't had a baby yet? You still haven't had a baby yet? You married about 3 years ago. You still don't have a baby? Guess what? The man is the cause. His sperm is not good enough to impregnate. And in fact, in a major work I did in this area, I proved that it's now possible for a child to have up to 6 parents.
How is that possible?
Do you want me to say it now or leave it to the end?
Say it now. Let's there might be other issues that would arise from there.
You know, the success rates of this technology, the best place to go in this world is Australia. Australia is the leading country when it comes to solving problems of infertility. Oh yes, they do it right. Let me just say that because I've been talking about best practices. America, where I came from, yes and no. England, yes and no. But the people who actually devote their time, you know, in a very, very holistic manner are the Australians. Let me tell you, they are even trying out male pregnancy as we speak. Male. Because what does it take? Sperm, egg, cultivate it in a petri dish, put it in and let it divide, and take it later and insert, and then the pregnancy occurs. They've tried chimpanzee and with a male chimpanzee, and they have succeeded, but through cesarean. So the world, you know, and at the same time, like I have said, doing this, what these whole medical doctors do that are wrong. Some people also go for sperm from Nobel laureates, intelligent people, so that they can have intelligent children. That is usually practiced among wealthy people. When we come to the case of Mengwalu versus Mengwalu, where a former head of state participated, I'll let you know. But for now, you ask the question.
How is it possible to have 6?
For a child to have 6 parents?
Yes.
It's very simple. I cannot draw, but I will explain it. When you take a man and woman, a husband and wife, look at my 2 fingers, a husband and wife, man, woman, HW. Man and woman, right?
Yes.
Yeah. Okay. The husband and the couple on this side, the sperm, the man has a very low sperm count. This woman has suffered from a very serious disease, what they call latent abortion. It doesn't even produce eggs, so she's kind of hopelessly infertile for the woman. So the couple is infertile. We understand that?
That's right.
Okay. So I classified them as commissioning parents. They went to this doctor here with my thumb, told them their story, and commissioned the job to the doctor to carry out the job for them. The man and woman here, what makes this very interesting, they may be married, they may not be married, but the egg and the sperm is what the doctor is going to use to carry out IVF.
For the infertile couple.
For the infertile couple.
That's right.
And so that they can have a child. All right? Okay. So this couple here, I call them genetic parents. When you look at it, it's very simple. Commissioning, genetic, because it's their genes, it's their gametic materials according to medical science. By the way, I'm not a doctor, but I have sufficient knowledge of this area to say what I'm saying, that they are correct. And I stand to be tested by any of the specialists in this area. Genetic parents, commissioning parents. You have 4 there, right?
That's right.
This man,
the doctor,
is the arranger, to use the Nigerian English, because he is the one recombining these whole things in new ways, all with the main objective of coming up with a child. So we have 5 people there. Okay. So he carried out an IVF procedure successfully after several trials. Sometimes they go through the navel of the woman to suck out the egg, and the procedure is very rigorous. Sometimes some women will do 2-3 times, they say they don't want to do it again. But this time, it was successful. Now, coming to implantation, this woman it was discovered that this woman had a back problem and cannot carry pregnancy to term. Okay? Okay. So the same man, doctor, brings out another woman here, which is my finger, to act as a surrogate to carry. You are following me, yes. Right? To carry the proceeds of all this, get pregnant, 9 months thereafter, have the baby, and hand over to the commissioning parents. Okay. I argued in another document where when you look at the role played, you know now we have the commissioning parents, yes. We have genetic parents, then you have the arranger. We have the arranger doctor. Yes. Okay. Then we have the surrogate motherhood. So we have labeled all of them. Now, I argued, and I stand by that anytime, that because of the role this doctor had played all along, putting all this whole thing together in new ways to ensure that the objective of having a child is met, I qualified him as a parent. Because what is parenthood? Parenthood is the man in the house who you know, with the way life is today, because the whole structure of family definition has lost its definition. You know, family today is household. Who are the people in your house? There must be a head of a household. This man plays the head of a household in putting all these things together, and I qualified it in some